My name's Dr. Jim Grimes. I'm a licensed clinical psychologist. I've been in practice now for about 10 years. I've been licensed for 6, been seeing clients now for 17 years since I started in graduate school. The population I work with is largely a Christian-based population, and that's because the work I do incorporates people's faith into the process of the therapy. I wanted that to be integrated for them and not something that was two separate experiences. So I see both individual and couple, and the typical age range I see can run anywhere from a young adolescent to someone, I believe the oldest client I've worked with personally was 79. What I do when I'm working with people is I first start off by really wanting to pay attention to them, each of them as an individual, in the sense of what they want me to know about the problems they are experiencing. I really try to set aside any preconceived notion I may have of what the problem is they say they're coming in with. And I want to understand it in the context of the entirety of their life. So I get them to tell me as much as they are able to about their history and their life growing up, and how that may still have themes that play out currently in the relationships that they are experiencing difficulties in. So I largely take the adaptive information processing model that EMDR uses, and I apply it to the history taking I use with my clients. And I begin to look for these key moments where they have emotional or relational injuries that take place, that are arrested, they become stuck. And then I begin to look for other occurrences as they happen in life. And then if I've got a couple who's before me, I look at how that theme plays out for each of them in their interaction with one another. So in the work I do, I try to approach things on a number of levels. EMDR addresses things looking at both the image, the thoughts, the feelings, and the sensations. And I work to incorporate a lot of that into the work I do with my clients, where I want them to understand what they're stepping into, what the process is going to be, how long treatment's going to take, and what they can expect ultimately as results for it. I'll talk about that pattern I see present that's taking place between the two of them, how their past issues are contributing to their current difficulties. And then I'll talk about the therapeutic plan we're going to put into place that will help them walk step by step through all the difficulties that they are having. And it's just a general framework that I'll apply to any circumstance, whether I'm dealing with someone with depression, whether I'm dealing with anxiety, whether I'm dealing with addictions. It all kind of has just a really good grid work that we can use in walking each client I have through the process of healing that they can achieve. I also spend just a fair amount of time kind of clarifying from them what life would look like if this were no longer a problem for them, so that ultimately I'm not just looking at the issue they came in for, but I'm also taking a snapshot of the life they want to move towards.